Principles of safe drug administration. The main responsibility of administering drug is held by the nurse attending the patient. The prescription is a document given by the doctor which states the appropriate medication that is used for the treatment of the patient. It is the duty of the nurse to facilitate the administration of the drug to the patient following the correct principles. There are 6 principles of safe drug administration. The principles of right drug administration are: when the prescription is issued by the doctor, the name, age, sex, and the medical condition of the patient is mentioned on the prescription note. The nurse must check the name and update the same in the appropriate medical record of the patient before ordering the drug. The drug name must be identified from the doctor's order. The medication provided must be arranged from the pharmacy of the hospital. In case of any doubt on the medication that is being delivered, check with the doctor. The dosage of the drug that needs to be given is mentioned in the prescription. Once the medication is arranged from the pharmacy, the nurse divides the medication into the appropriate dose for administration. The amount of time a drug acts on the body is limited. So, a drug must be given at regular intervals of time. The doctor mentions the number of times the drug has to be given to the patient. The action of the drug also depends on the route in which the drug is administered. The nurse must check the prescription for instructions on the route of administering a drug. Once the medication is administered, the nurse must observe for changes in the patient condition to understand the action of the drug. The dose, time, and the route must be documented for further reference. If these principles of drug administration are followed, the drug administered will act on the patient and help in the fast recovery of the patient. Role of the hospital assistant. Once the prescription of the drugs has been issued by the doctor, the nurse arranges for the administration of the drug. Your role in the drug administration process is to assist the nurse while following the right principles. The drug that has been advised by the doctor has to be ordered from the pharmacy. You must assist the nurse in procuring the ordered medicine and check if the drug given is appropriate. After the drug is delivered to the nurse divides the drug into the given dosage. Help the nurse in making and storing the correct dosage of the medication. Depending on the route of administration, the required equipment has to be arranged for the nurse to administer the drug. If the drug is administered through an IV, keep checking the level of the drug in the IV fluid bottle and report the same to the nurse. Check with the nurse on the timing of administering the drug. Remind the nurse if the time of the drug administration is approaching. The documentation of the drug administration process is prepared by the nurse. Assist the nurse in the process of documentation. General precautions to be taken during drug administration. Administration of the wrong medication can be life-threatening. Always double-check if the correct medication is being given to the patient. Do not mix the drugs of different patients together. Some medications may have side effects, which are abnormalities observed like vomiting, loose motions, etc. If the patient complains of any abnormality after the drug has been given, report it to the nurse and the doctor immediately. Patients might react adversely with sneezing and rashes on skin immediately after the drug are administered. Such reactions should be reported to the doctor immediately and need emergency care. The equipment that is used for the administration of the drug must be kept sterile and infection-free. You must ensure that the equipment of drug administration is sterilized and arranged for the nurse. Drug administration is a very critical process in the treatment of a medical condition, and the process of administration is a team effort with the nurse playing a central role. You must be aware of the process and help the nurse at the different stages to facilitate a safe administration of the drug.